Thyroid conditions in cats is a very big problem. The top three conditions that we see in older age cats are, number one is actually kidney failure, number two probably hyperthyroid, and number three we do get diabetes in cats, but it's relatively rare. Hyperthyroid is an overproduction of the thyroid hormones within the body from the thyroid gland. And they don't know exactly all the mechanisms, but it's an overstimulation or overexcretion of thyroid hormones. The biggest thing that we see is that are in 13 to 14-year-old cats, older cats. They can start as early as 6 years of age. One of the big complaints people will have is the cat is ravenous, the cat is nervous, the cat is attacking people, the cat is having GI upset, vomiting and diarrhea. And these are all, if you've ever known anybody in your family who's thin as a rail, who can't sit still, and keeps active all the time, there may be cause to check their thyroid. But with cats, it's a really serious problem. It increases their metabolism, where they don't hold weight. Two of the main things, though, that it does cause problems with heart. We get into heart disease. It's called cardiomyopathy. It's hypertrophic cardiomyopathy, where it's actually the heart in itself becomes stretched or oversized, and it doesn't function well as a pumping organ. We see heart murmurs are very distinct that we see in these cats, very easy to pick up. If we feel underneath their throat, right in this area right here where the thyroid glands naturally are, we shouldn't really be able to feel those, but in a cat that is hyperthyroid, that gland will be very, very large, and we can actually feel that gland. The other thing, because of the heart situation and the increase in metabolism, is we see an increase in blood pressure. That increase in blood pressure is very, very detrimental to normal kidney function. Kidneys are important, as we all well know. It's a managing organ that helps to clean out the body and to eliminate toxic waste. These older individuals can be helped, though. First, we have to diagnose it. It's simply done by taking blood work, checking their values. I mean, I'm talking about a complete blood panel, and looking at their thyroid levels. If the thyroid elevation is high enough, then it's recommended that we treat it. We treat it using primarily a product called methimazole. And methimazole actually is it's fairly selective. It causes actually death of some of the thyroid tissue. So what we do is we destroy a percentage of the thyroid gland with this medication. Then when that decreases the release of the thyroid hormone, and consequently we get an animal that starts to settle down. Their metabolic rate or metabolism slows down, where they're not nearly as nervous. They don't have the stomach upset, the vomiting, and the diarrhea associated with being overactive thyroid. And they also, the hard part though is the heart itself. That damage is there. Sometimes we have to use medication, heart medication for cats, and then also blood pressure medication to decrease that blood pressure so that the kidneys are not damaged. Treatment is very difficult in cats. It's the difficulty in treating a cat is why cats so many times go untreated for many diseases. What we do have at our disposal now are compounded products. A standard methimazole tablet is a small tablet that's given to cats in an oral manner. Giving a cat a pill is like the old saying, it's like herding cats. It's very, very hard. Very difficult to get that consistently in the cat. Fortunately enough, we have compounding pharmacies nowadays, and even other pharmacies that are starting to compound products or manufacture products that are flavored. They're flavored chewable tablets that can be given to the cat as a treat. Many of those work quite well. Again, it's still giving an oral medication, and cats do struggle with that. The most common thing now that's come into vogue is actually specialized syringes. These are dosing syringes that are used, and they're in a compound, a carrier compound, that is actually what's called a transdermal gel, meaning the medication is in a carrier agent, and that agent is absorbed through the skin. The product is applied to the skin surface. That is absorbed through the skin and goes into circulation. Many of the cats that I have that are hyperthyroid, I have the medication that suppresses or actually destroys thyroid tissue, the methimazole, and I also have the blood pressure. They can be compounded together, placed in these transdermal gels, put in specialized dosing syringes, and we apply it to the inside of the ear of the cat. It's rubbed in, and it's done on usually a twice-a-day dosing. This has made treatment for cats a lot easier for us as veterinarians and for clients. But hyperthyroid is a serious condition seen in older cats, and it can be helped with medication.